In this video, we are going to cover the new ED sepsis screening assessment. Now, instead of having to screen everyone for sepsis, it's going to be based on 19 chief complaints that were chosen by the core measures team. So, when you come in, you will have your patient open. So I'm going to open the chart on the selected patient, and once I go in and I triage my patient and the work list now reloads and is updated, if it is a chosen chief complaint, meaning complaints we know sepsis can trigger from, so a chest pain, an abdominal pain, a fever, a wound, etc., it would automatically be added and starred as required on your work list. What you would do is you would go in. I like to highlight the assessment I'm on so I can see the green row go all the way across. I would hit check and document now. This is very simple. It just asks a couple of little questions. The nice part is if there was any associated data back, meaning any of these labs or information, it would be very hard in the ED for them to realistically be back when we're doing this initially. But if you did see that A back, let's say the patient was in triage for a while, sitting in the waiting room waiting to come back, you would get a little A that would populate here, kind of like that little P you see for protocol on the main screen, and you would be able to click it and any of these lab results that were back would show up. It's a way to help reduce going in and out of the system. So you basically have to answer these two first sets of questions that are starred, as you see here, and then if it meets criteria, it will prompt you if you need the level 3 information. So very simple. Is there a suspected infection? Yes, there's suspected infection. There's a documented infection based on the things below, or none. So let's say the patient has none. It's going to now blank out this one because it doesn't matter what's there. It's not even going to ask you for it. Is any SIRS criteria present? So are any of these 4 things there? Temperature greater than 101, a respiratory rate greater than 20, a white count in this range, or a pulse greater than 90. So let's say my patient's pulse is greater than 90. It's telling me there's no definite risk, so there's no action required. If I had been flagged for sepsis, it would have told me that. So let's say there was a suspected new infection, my temperature is high, my respiratory rate's high. It now asks me if I have any of these. So the nice part is there's a none, because sometimes in the ED we will only have a blood sugar or a change in mental status right away. We're going to check those things, especially if there's a change in mental status, but we might not have any else back because they're just walking in. So I can say explained new change, new unexplained change in mental status. It now makes my sepsis screen severe risk, and I can say I notify the physician and who I notified and hit save and exit. This now saves your assessment and there's nothing else you have to do. It would just leave it updated, and you can go back on your tracker and you would see on your screen when you hit refresh that your sepsis screen was done as the result updates here.